Hello everyone, welcome to Dental Mate. Today in this video we'll be talking about the theories of eruption. Let's get started. So what is eruption? It is the axial or occlusal movement of the tooth from its developmental position within the jaw to its functional position in the occlusal plane. Along with that, it is eruption. It occurs later to compensate for the masticatory wear and to maintain the position of the teeth in the growing jaws. So all of these are the physiological tooth movements and they could be described under three headings. That is pre-eruptive movement, eruptive tooth movement and the post-eruptive movement. So first of all is the pre-eruptive movement. So this is the tooth germ, developing tooth germ, right? Now if this tooth germ makes any movement within the growing jaw bone, okay, this is the pre-eruptive movement. Now next is the eruptive tooth movement. So this movement is made by a developed tooth as it moves from the jawbone to the functional occlusal plane in the oral cavity. Next is the post-eruptive tooth movement, right? So this is made by the fully erupted tooth. It is done to compensate for the occlusal wear and to maintain the occlusal table as the jawbone continues to grow. Now superimposed on all these three type of movements is the replacement of the entire dentition, deciduous dentition by permanent dentition. So different theories have been put forward to explain the phenomenon of eruption because many factors have been considered to play a significant role in the process of eruption of teeth. The four most popular theories are the bone remodeling theory, root formation theory, vascular pressure theory, and the periodic ligament traction theory. So each theories will be talking about the supporting evidences and the demerits. So first is the bone remodeling theory. Now according to this theory, resorption of bone in the front of the erupting teeth and the deposition of bone behind the erupting teeth. This results in tooth movement or tooth eruption. So in the apical region of the teeth, there is resorption, there is deposition of bone, and in the crown region of the teeth, adjacent to the crown region of the teeth, there is resorption of bone. This leads to eruption of teeth. So there are supporting evidences, certain supporting evidences for this theory. First of all, if the tooth germ was removed experimentally and the dental follicle was intact, then an eruptive pathway was formed. Along with that, if a silicone replica was substituted with the tooth germ, then the silicone replica erupted like a normal tooth. Third, if the dental follicle was completely removed, then no eruptive pathway was formed. So what is the role of dental follicle in remodeling? See, there is absolute requirement of dental follicle for bone remodeling and tooth eruption. Why? Because the blood vessels which are present in the dental follicle, that is the vascular supply, it provides a source for the osteoblasts, which are the new bone forming cells, and it also provides a pathway for the osteoclasts, which are derived from the monocytes. So what is the role of these osteoblasts in bone remodeling? What happens is these osteoblasts, they are under hormonal control. They secrete collagenase and other proteolytic enzymes. Okay, this removes the osteoid layer, and the osteoblasts round up and expose the newly denuded mineralized bone surface. ठीक है, क्या हो रहा है, अंडर हार्मोनल रेगुलेशन जो ऑस्टियोब्लास्ट है वो कोलाजिनेज सिक्रीट कर रहे हैं, जिसकी वजह से क्या हो रहा है, जो ऑस्टियोइड लेयर है वो रिमूव हो जा रही है. द ऑस्टियोब्लास्ट राउंड अप एंड दे एक्सपोज द denuded mineralized bone surface, जिसकी वजह से क्या हो रहा है, दे आर प्रोवाइडिंग अ स्टिम्युलस फॉर द ऑस्टियोक्लास्ट टू दैट to come and attract to that site. Okay. Okay. Now, what is the supporting evidence for this? In animals that exhibit genetic deficiency of osteoclast, tooth eruption is prevented. Okay. Now, whether this mechanism that occurs around the teeth causes or is it the effect of the tooth movement, that is not known. Okay, so what is basically happening is the osteoid layer, so the osteoblast ये लोग क्या कर रहे हैं, under hormonal influence they are secreting the collagenase and जिसकी वजह से osteoid layer remove हो जा रही है. osteoblast जो है वो पूरा उसको round off कर ले रहे हैं and the denuded mineralized area is exposed, to which the osteoclasts get attracted and there is resorption of the bone from that area. Along with that, there occurs bone deposition in the apical area. But what is not clear is whether this is because of the tooth eruption or is it causing the tooth eruption. Okay, now second theory is the root formation theory. With the name itself, it is clear we are talking about the theories of tooth eruption, which is occurring why? Because of the root formation. So according to this theory, the eruption of tooth is brought about by the occlusal movement of the tooth. Now, this occlusal movement occurs why? Because this occlusal movement which occurs to accommodate the growing root. Now the root formation follows the crown formation is very clear. It involves the cellular proliferation and the formation of new tissue. That must be, see, whenever there is root formation, there is cellular formation, cellular proliferation and new tissue formation. Now this cellular proliferation and new tissue formation must be accommodated. How is it accommodated? It is accommodated by the occlusal movement of the crown of the teeth. Now, if this occlusal movement is prevented, hampered due to any reason, then what happens? There is resorption of the bone at the base of the socket. See, one thing is, if the root formation is the eruptive force, as claimed by this theory, then the apical growth of the root, it needs to be translated into the occlusal movement, right? अगर रूट फॉर्मेशन सच में बेस है फॉर द टूथ इरप्शन, तो जो अपाइकल ग्रोथ हो रहा है वहां पे जो प्रेशर है it is needed to be translated into occlusion movement. Now for this it requires a fixed base. This theory postulated that there is an existence of a fixed base which is a cushion hammock ligament that straddles the base of the socket from one bony wall to other like a sling, and this acts as a strong base for this. Okay, so this theory claimed that there was a fixed base which is present and the cushion hammock ligament was attached to the base of the socket like a sling. When the apical forces were generated because of the root growth, then this forces, the cushion hammock ligament acted like a sling and it translated these forces to the occlusal movement, leading to the occlusal movement of the tooth. Now what were the demerits of this theory? So no such fixed base exists. See, the bone which is present in the socket, base of the socket, it cannot act as a fixed base because the pressure on the bone would result in the resorption of the bone itself. Okay, and no cushion hammock ligament is present. Okay, it is the pulp delineating membrane which separates the dental pulp from the periapical tissue. It do not have any bony attachment, so it is not able to function as a fixed base. Along with that, some teeth, they move to a greater distance during the eruption in the oral cavity than the actual length of the tooth. ठीक है, टूथ लेंथ से ज्यादा मूवमेंट हो रही है तो रूट फॉर्मेशन जितना है, जितना लेंथ ऑफ द रूट है उतनी मूवमेंट होनी चाहिए थी ना, नॉट ग्रेटर देन दैट. The experimental resection of the developing root do not stop the eruption of the tooth. And the rootless tooth, they are also found to be erupting. But still, we can say that root formation. Now, the third theory is the hydrostatic pressure or the vascular pressure theory. So according to this theory, what happens is there is a local increase in the tissue fluid pressure in the periapical region, which causes the occlusal movement of the tooth. So in the periapical region of the teeth, in this area, there is a local increase in the tissue fluid pressure. Okay. So what happens is the periapical tissue, as we have seen, they contain many blood vessels. The active fluid movement from these fenestrated capillaries into the local periapical area takes place. So there is a swelling of the ground substance tissue by about 50%, and the periapical tissue is in a closed space. This differential pressure is generated between the tissues above and below on the erupting tooth, and there is a local increased pressure which causes the tooth to erupt. So there are various experimental supports for this theory. First is the hypotensive drugs. So the hypotensive drugs, they induce increase in the hydrostatic pressure and there is increased rate of eruption of the tooth. Second is the sympathetic nerves. Now when the sympathetic nerves are stimulated, then the vasoconstriction occurs and there is decreased hydrostatic pressure which decreases the rate of tooth eruption. If there are more amount of fenestrated capillaries, then eruption rate is increased. Along with that, if there is more distribution of fenestrated capillaries near the base of the crypt than the alveolar crest, then there was more intensive or increased rate of eruption of tooth. 2% lignocaine with adrenaline over the roots of the erupting teeth in the prefunctional phase of eruption caused increase in the eruption. Along with that, the teeth which received vasoconstrictors, they showed decreased in the eruption rate. But there were certain demerits for this theory also. What were they? The differential pressure which was created is transient. Okay, we cannot assure regarding this differential pressure. So this differential pressure is transient and it is doubtful whether this is the only factor which is responsible for the tooth movement. Along with that, lack of blood supply, it also affects other factors such as tissue growth, which could be even responsible for the decrease in the eruption. So only vascular pressure role for the eruption of the tooth is highly doubtful. Next is the periodontal ligament traction theory. Now, according to this theory, a contractile force is created by the cells and the fibers of the PDL ligament. Okay? Which helps in pulling the tooth into occlusion. Now, what happens is the dental follicle, as they develop, the periodontal ligament, it contains the myofibroblasts. Now, these myofibroblasts, they show certain intracellular contractile filaments, that is the actin and myosin. Along with that, they have increased number of intercellular junctions. And they have fibronexus, which is the specialized structures providing connection between the collagen fibers and the intracellular filaments of the fibroblasts. Okay. So as the myofibroblast contract, what happens is the intracellular attachments, this sums up all the contractile forces which are generated from all the myofibroblasts and they are transferred into the fibronexus and then the collagen fibers which are attached to the tooth. Okay. So these are the periodontal ligament cells. As they contract, all the contractile forces, they are transferred to the fibronexus and then the collagen fibers, and the as they contract, there is an upward eruptive force which is generated and the tooth erupts in the oral cavity. Now, the rapid remodeling of the collagen fibers and the root elongation, it helps to maintain the oblique orientation of the fibers, because of which the forces जो है वो और अच्छे से transfer हो पाएंगे. Okay, more amount of contractile forces could be generated and they would push the teeth into the occlusal direction. Now there are certain what are the experimental supports for this? So when the vitamin C were induced, then there occurred periodontal ligament destruction and the eruption rate slowed down. Okay, so it indicates the role of periodontal ligament in the eruption of the tooth. Along with that, silicone rubber in which the fibroblasts were present, they were implanted into the root socket and the wrinkles were created on the rubber. This indicates that the traction forces have been generated by moving fibroblasts. Also, the myofibroblast, when they were embedded in the collagen gel and a disc of the root tissue is attached to the gel. Okay, so they align themselves parallel to the collagen fibers. These myofibroblasts, it was seen that they have aligned themselves parallel to the collagen fibers, and there was a connection established between each other and to the collagen fibers. So the collagen gel henceforth was converted into a 3D structure and the root disc was moved in this 3D structure. Okay. Along with that, certain experiments were performed in the animals, and it showed that there was persistent movement of the tooth only when the period was present. So this rejected the possibility or the possible effect of the root growth and the vascular pressure for tooth eruption. Now, when the root was resected and a metallic barrier was interposed in that region, then what happened? The distal fragment of the root erupted, and the dental follicle was attached to that fragment. Okay. Next, when there were certain abnormalities present in the dental follicle, such as multiple calcifying hyperplastic dental follicle, means the dental follicle showed calcifications, and if the mucopolysaccharidosis type 6, which is a genetic disorder of carbohydrate metabolism, was present, in which there is excessive accumulation of dermatin sulfate, then there was delayed eruption of teeth seen. So one of the tooth has appeared in the oral cavity before it attains in the its final position, that is pre-functional phase. The periodontal fibers exert the tractional force due to the attachment because they are attached in the alveolar bone and because of their orientation. Okay, we must remember that the orientation of the periodontal fibers is also important. Now if we summarize, then we can say that the eruptive movement, it is a multifactorial process. Okay. Now the selective bone deposition and resorption, along with the proliferation of root because of the fixed base and the creation of the apical force, these felicitate root formation. These are the parts of what? Bone remodeling theory and the root formation theory. Next, if there is a local increase in the tissue fluid and the contractile forces generated by a properly aligned and oriented periodontal ligament, that is dental follicle, this two, that is the periodontal ligament traction theory and the vascular pressure theory, They play an important role in the process of eruption. This is it about the theories of eruption. Thanks for watching. Do not forget to like, share and subscribe to my channel. Do hit the bell icon if you don't want to miss any latest updates. Let me know in the comment section below if this video has helped you in any way, as this would boost me to make videos of even better versions for you all. Stay tuned, keep visiting. Thank you.